South Africa resumes the Sisonke vaccine rollout plan for healthcare workers this week. It is also coincidentally World Immunization Week. UNICEF says that the drop in routine immunization coverage in South Africa over the past 13 months due to COVID-19 could lead to a resurgence of vaccine-preventable childhood diseases. We speak to UNICEF's Christine Mohigana to find out more about the concerning trend and what is being done to ensure routine vaccination targets get back on track. Christine, a very good afternoon. Thank you for speaking to us. A little bit worrisome that we are behind in vaccinating young children.
That's correct, Hugo, and good afternoon to you and all viewers. Since the beginning of the pandemic, we estimate, the data from the National Department of Health suggests that close to 300,000 children missed their immunization visits against preventable diseases. And what we're doing now in support of the efforts of the National Department of Health is to make sure that we catch up with those children who have missed their jabs.
Now, 300,000 is roughly a third of all children that should be immunized, correct?
That's correct. It's a significant amount of children that we need to reach out to. And we've started already from November last year to January this year, but we encounter challenges. We continue to remain below the targets that we would like to reach. The catch-up drive that I just referred to was covering 12 priority districts, and we're doing what we can to work with partners and in support of the National Department of Health, but we're still falling short, and therefore have to continue the efforts, and hence the call that we are making today, that attention continues to be given in investments made in vaccination of children, vaccination against preventable diseases through immunization drives.
Walk us through, please, Christine, what the drive actually entails. If you're going above and beyond to catch up, what is it that you are doing differently?
So what we're doing now is supporting the National Department of Health to cover, during this upcoming catch-up drive, 52 districts through technical and monitoring support, which means that we help the provincial authorities and district authorities that need the support, so in the priority districts, to have the resources, human, financial, technical, to make sure that the children who were missed are reached out to, brought to where the immunization is taking place.
Are mobile interventions an option? I'd like to assume that many of the people that are not bringing their children to centres to be immunized are failing to do so because of financial reasons or similar, particularly because of COVID.
That's right. That's one of the dimensions, financial resources for transport, for example. But there is also fear to go to a health center, a health clinic, because of the presence of the COVID-19 cases, and there is also sorry, I'm losing my train of thought there.
Okay, we'll let you come back to that, but maybe
yes.
let's talk, Christine, about the implications of a little over 250,000 children not being vaccinated or having missed their vaccinations. What are the implications of this?
The very simple implication, Hugo, is resurgence of childhood diseases that can be prevented through immunization. Vaccination work. If a child is vaccinated against measles, he will not fall sick, but if he has been missed out and has not received his immunization, he's susceptible of becoming sick.
Now, we know that, or I'd like to believe that measles spreads rather prolifically.
Absolutely. It's an infectious disease, and since we do have, the means to prevent it, it's very important that we make sure that all children are vaccinated.
So are we doing basic activation or outreach? Are we on radio multiple times, on a TV, talking about this? Because outside of conversations that we're having here on the news, I haven't actually picked anything up. Not that I would have children that need to be vaccinated, but one would think that if it is as dire as it's made to sound, that greater effort would be made, so to speak.
Yes, and we're doing that. It's just that, as you may imagine, there's a lot of attention now put on the response to the COVID-19 pandemic. There is a lot of attention to what needs to be done to contain the further spread of COVID-19 virus here and elsewhere. So what we're calling for really is what you're helping us to do now through your program is to indicate and highlight the fact that there are other types of immunization, other types of public health interventions that continue to go on, continue to be organized through the health system in the country, and attention needs to be brought to them, and we want during this World Immunization Week, but beyond that, and we've of course also done that before through the catch-up drive that I referred to earlier, which started in November last year. We want to make sure that attention continues to be on the need for routine immunization services to reach children across the country.
I can imagine that you've charted a plan on when you will achieve the timelines that you expect to achieve. Can you take us through this? And at what point will you start to worry if you don't achieve those timelines?
The timeline for routine immunization, as the name suggests, is that there is actually no particular time frame. Children are born every day, as you know, and there is a window within which they need to be reached for their immunization as they are, under 5 years old. So what we're doing now is catching up on those who were missed, the 300,000 some that I mentioned earlier, who were missed because of the lockdown-related COVID-19 measures. But this is an effort that continues. As we catch up with those that were missed, we want to make sure that the new cohorts of children who need to be immunized are also immunized, so that we don't continue to be behind on the immunization efforts. So we want to catch up as quickly as possible, and surmount all the bottlenecks and obstacles that are related to the competing priorities of today because of the context, because of the COVID-19 pandemic, but also make sure that the routine immunization, which is every day when a child needs to be immunized, he or she is immunized, is a service that's provided to families, to communities, and is there and strong.
Finally, Christine, we focus a lot on the children because that is what we expect, that children will be immunized. There's obviously a lot of immunization going on, or vaccination going on, certainly with COVID-19. Are there any other groups that are periodically immunized that we might not have already touched on?
Our mandate, UNICEF's mandate, is on children and child immunization. There are immunization that are taking place for adolescents, for example, adolescent girls. And my message there would be to say that, all other health services that need to be maintained, that need to be available to people that need them, should get the attention that they deserve. in spite of the, of course, priority attention and investment that the country, government here in South Africa and elsewhere, the whole international community needs to put on, stopping the spread of the COVID-19 pandemic. But all other services should continue to be available to children, adolescents that need them.
Christine Muhigana, thank you kindly for speaking to us this afternoon. Christine Muhigana, Chief of Health at UNICEF, giving us an update on the number of children that need to be immunized. Apparently 300,000 missed immunization late last year.